Another minute maternity for what you do about DIC. All right, how do you recognize it? What do you do? Signs and symptoms. A petechial rash from all those little microclots. Conjunctival hemorrhage. You see broken blood vessels in the eyes, ecchymosis, or a lot of bruising in places where people wouldn't bruise normally and there's been no trauma. You'll see bleeding from IV sites in the Foley bag, at the incision if it's a C-section, in the gums. And then you'll start to see hypotension, tachycardia, decreased O2 saturation. And this can progress to bleeding in the organs, pulmonary edema, kidney damage, liver damage. So there's a lot of morbidity and mortality with this. So be especially suspicious if you are aware of an underlying condition. You start to see petechiae, you start to see changes in the vital signs, and you know the patient had a temperature of 102.1. You will get labs. The biggest one is the fibrinogen. If it's less than 100, normally in pregnancy, it's elevated to 300 to 400. That's the first thing to go. The fibrinogen gets used up first. But by the time you're seeing labs, you're kind of already behind. So it's not the most reliable indicator. It's a clinical judgment. So interventions, again, any bleeding emergency, large bore IV, 2 sites are preferable, so 18 gauge, but be careful if you have to start an IV or draw labs because venipuncture is going to precipitate further bleeding. So put pressure on that for a long time. Volume replacement, always. Got to replace the fluid. You got to give the heart something to pump. You're going to use saline or lactated ringers. Massive transfusion protocol, and that's different types of blood products. Usually you get 2 units of packed red cells, cryoprecipitate, or FFPs with the massive transfusion. And the big one, control the underlying condition, take the stress off the body.